Every year, pneumonia sends more than 1 million people to the hospital in the United States alone, and it's still one of the leading causes of death from infectious disease. Yet many people mistake it for a lingering cold or a bad flu until it's already serious. Today, we're breaking down exactly what pneumonia is, the symptoms you need to watch for, who's most at risk, and when it's time to see a doctor. Hi everyone, welcome back to the channel. If you've ever had a cough that just wouldn't quit, or watched a loved one struggle to catch their breath, this video is for you. We're going deep on pneumonia today, not to scare you, but to arm you with the knowledge to catch it early, because with this disease, timing can make all the difference. So what's actually happening in your body when you have pneumonia? Pneumonia is an infection that inflames the air sacs in one or both lungs, called alveoli. Normally those tiny sacs fill with air every time you breathe, but when pneumonia strikes they fill with fluid or pus instead. That's why breathing suddenly feels like work. It can be caused by bacteria, viruses, or fungi. The most common bacterial culprit is Streptococcus pneumonia, but viruses like the flu, RSV, and even COVID-19 can trigger it too. Sometimes pneumonia develops on its own, other times it sneaks in after a cold, or the flu has already worn down your defenses. The symptoms to watch for. Here's the tricky part. Early pneumonia can look a lot like a common cold or flu, but there are key signs that set it apart. A cough that produces thick, yellow, green, or even blood-tinged mucus chest pain that gets sharper when you breathe deeply, or cough fever, sweating, and shaking chills. Or, in older adults, a body temperature that's actually lower than normal shortness of breath, even during light activity. Fatigue that feels disproportionate to how sick you should feel, nausea, vomiting, or diarrhea in some cases. And this one surprises people, confusion or sudden changes in mental clarity, especially in adults over 65. That confusion symptom is important. In older patients, pneumonia doesn't always announce itself with a dramatic fever. Sometimes the first sign is simply a family member noticing that grandma seems off or unusually disoriented. For infants and very young children, symptoms can be even more subtle. They might not cough at all. Instead, watch for restlessness, poor feeding, vomiting, or noticeably labored breathing. Pneumonia can affect anyone, but certain groups face a significantly higher risk of severe illness. Adults 65 and older, whose immune defenses naturally weaken with age. Children under 2, whose immune systems are still developing. People with chronic conditions like asthma, COPD, heart disease, or diabetes. Smokers, since smoking damages the lungs' natural ability to filter out germs. Anyone with a weakened immune system, from HIV, chemotherapy, or organ transplant medications. And people who are hospitalized, particularly those on ventilators, since that raises the risk of a more resistant, harder-to-treat form of pneumonia. Here's why doctors take pneumonia seriously, even when it starts out mild. Left untreated, or in high-risk patients even with treatment, pneumonia can lead to serious complications. Bacteria can enter the bloodstream, a condition called bacteremia, which can spread infection to other organs. Fluid can build up around the lungs, known as pleural effusion, sometimes requiring drainage. In severe cases, an abscess, a pocket of pus, can form directly in the lung tissue, and breathing can become so difficult that hospitalization and supplemental oxygen, or even a ventilator, become necessary. This is exactly why doctors stress catching it early. The sooner pneumonia is identified, the better the odds of a straightforward recovery. When to see a doctor. So when should you actually pick up the phone and call your doctor? Seek medical attention if you experience difficulty breathing, persistent chest pain, a fever of 102°F or higher that won't come down, or a cough that isn't improving, especially when bringing up pus. And if you fall into one of those higher risk groups we just covered, don't wait it out. Early evaluation matters far more for you than for a generally healthy adult. The bottom line, pneumonia is common, it's treatable, and in most cases people recover fully within a few weeks. But it's also a disease that can escalate quickly in the wrong circumstances, which is exactly why staying vaccinated, avoiding smoking, and knowing these warning signs matters so much. If you found this helpful, hit subscribe for more evidence-based health breakdowns, and drop a comment if there's a topic you'd like us to cover next. Stay healthy, and we'll see you in the next video.